Alright, let's get this thing started. Huh? Alright, I'm tired.
Yes, I am.
Alright, so let's get this thing started. Alright, so we're here Sunday morning. Oh yes, this afternoon, right? We want us to get this project together. Let us see how we can kind of go through and brainstorm, which is critical, so that we be able to maximize the project. Right? So we want to go through the course, go through the course for that we read it, and let's see what we're going to do.
This group project and background. Clients are all around us, but professional counselors must distinguish themselves. Your goal: 1. Set a particular counseling setting or environment. 2. Choose an appropriate medium. 3. Create an effective advertisement for a counselor or counseling firm. Could also be an employee assistance program for some company. 4. Write a brief statement that provides detail of the rationale for your group's choice. 5. Be mindful that this is a scholarly exercise. Your presentation must reflect this standard. Right? And she gives us some criteria after. In order to complete your submission, you are encouraged to ask yourself the following questions to ensure that you have achieved a high quality of it. Be mindful that these questions are not a comprehensive list, but merely a guide to make sure that you have fulfilled your goal. 1. The final group product meets the stated criteria. 2. There is evidence of group collaboration.
I know we don't have to work on that.
Of course not.
There is sufficient evidence of theoretical reflection. 4. Presentation can be delivered within the allotted time of 20 to 30 minutes. Important. A group contract has been instituted and followed.
Do we need a group contract?
Wait, who writing the contract?
Who is the lawyer in the group?
Who writing the contract?
Lawyer?
We don't need any
What the contract is for?
I know, I think I'm asking like someone is the most
We could all go
technical
about
person.
contract. All agree?
Aye.
The group presentation is the work of your group for this course. Your paper is creative and scholarly.
Cool. Alright, I think definitely the ad is what we should focus on. In terms of creativity, I have the program already, but I can do the editing. So it's just for us to kind of work through the script, and once we do the script, we will be able to know what we will be doing. I know we will each given the task of what areas you wanted to focus on in terms of the theories.
Okay, so what's the 3 areas we decided to look at?
Yeah.
Cognitive.
Humanistic.
And humanistic.
Right.
Right? So, what we're going to approach this now.
Everybody came up with a name of the company, remember?
So
Oh,
we
yeah, that's
can
true.
form a company, right?
Right.
A counseling company, and we offer services to the public. Right? So we're going to have a small ad campaign. So we have a logo, we have a little two client campaigns.
Right, right.
Right? And we also do a commercial.
Yeah, cool.
Right?
How about Sam that? Because it starts with S.
No, how about mask?
Mars.
Mask.
Mars.
Sounds good.
Sam, that wasn't so bad enough.
No.
I think mask more appropriate, you know, these
So-
new letters, Marissa, Alison, Summer, Imara, and
I like mask.
I like Mars.
I think
So,
Mara.
so we voted over this?
Yeah, sure.
Yeah.
I think we can take a vote.
Let's do that.
All for Sam then.
No.
Okay, all for mask.
Yes.
Alright, well, the mask up.
Mars have
The
it.
mask.
The mask carpet.
Alright, so the name of our company would be Mass Concert Service.
Professional counselors.
Professional. Yeah, I like that.
We want to distinguish ourselves from the layman and out in the street to give people advice and damaging lives and stuff. We
Yeah.
actually train
Yeah.
individuals.
And I know that's critical to counseling. You must be able to be properly trained.
Yep.
I mean, the training that we do, it's not, we don't get certification, is it? No.
Licensure is a
License,
problem.
yeah, it's a problem, but at least we want to be able to be professionally trained. And we are professionals, so definitely we want to be able to distinguish ourselves from those quacks, so some of the quacks that we tend to see.
Okay.
Alright, cool. So our company's name is Mass Professional Counseling Service, right?
Services or services?
Services.
Services.
Okay.
Alright, what are we? Who are we?
Yeah, that's the kind of things we have to do.
Yeah. What are we? Who are we? I mean, I know we each come with our special areas of specialty in each market. So I think what we'll do, for the sake of the assignment due, let's talk briefly about what it is, our area of specialty is, and then we'll just put it together accordingly. Yeah? So I know we have people here who will be experts in the psychoanalytic theory. Yeah, and then there's cognitive and humanistic.
Okay.
So who wants to start?
Who would actually who is the person who would do the psychoanalytic work?
Yeah?
Someone.
Okay, cool. Tell us in terms of your area of skill, what would you bring to a mask?
Well, as a psychoanalytic theorist, we follow in the footsteps of Freud, Sigmund Freud.
Because she said,
We view human nature as dynamic, with the transformation and exchange of energy within the personality.
Okay.
So of course everybody knows about the id, the ego, and the superego. And we know about the conscious mind, the preconscious, and the unconscious.
Okay.
Unconscious. Sorry. We also look at the psychosexual development of individuals, the anal, oral, anal, phallic, latency, and genital. So we figure out the persons who are fixated at any stage of their development, and we encourage them to talk about their childhood experiences, things that happened in the past that they might be aware that might be affecting them, but still does. We look at defense mechanisms: depression, denial, regression, projection, rationalization, reaction, formation, and displacement.
Okay.
Our role is to encourage the individual to talk about whatever comes to mind, and like I said earlier on, the childhood experiences and different difficult thoughts that they may have. We want them to lie down on a couch, feel comfortable. We'll sit down behind them and we'll gain insight into their thoughts by reliving and working through their unresolved past experiences. Our goals with a focus on personal adjustment. Help clients go through development stages not previously resolved. Help them cope with the demands of society. Help the unhappy get happy. Make environmental adjustments and focus on work and intimacy. So, in all, we want to strengthen the ego so that perceptions and plans may become realistic.
That sounds good.
That sounds
That really sounds good. So,
Thank
so, okay, so we have someone with the psychoanalytic. Who's doing the humanistic? Is the next one? Okay, so as a psychoanalytic, so our next area we look at is the cognitive approach, right? And our specialist on the cognitive is Alison.
Yes. The cognitive behavioral counselors, these are the person thought, believe, and internal images, right, about the special events in people's life. Right, it was developed by Albert Ellis and Aaron back in the 50s and 60s. With Aaron back now, Aaron deals with emphasize on the importance of dysfunctional thoughts and how to allow the client to examine the thoughts themselves. Ellis, on the other hand, said, no matter how much insights a person gain, they never lose the symptom they started with. It may not be their past, but there must be their present.
okay, so that's basically what you'll be focusing on.
Yeah.
Okay, cool.
So, when you use the cognitive approach, the people that is most successful on is people who have average to above intelligence.
Okay.
Right? The person must have a moderate to high functional stress. The client must be able to identify thoughts and feelings. The client is not psychotic or disabled by present problems.
So the psychotic part is a good point because you can't use this particular treatment or take this approach on someone who's mentally ill.
Okay.
Alright, they are willing and able to complete systematic homework assignment. Because one thing with this approach that we have to give them homework. And they have to do the homework.
Just pass them to them.
Yes. They possess a repertoire of behavior skill and responsive. The client is able to process information on a visual and auditory level.
Okay.
The client frequently have inhibited mental functioning such as depression. Right? It's a three-pronged approach. They have like the REBT, which is rational emotive behavioral therapy.
Okay.
You have reality therapy and you have cognitive therapy. Right? Each of these therapy kind of slightly different in its approach. But the reality therapy now, this is based on the person's choice. And the successful application is dependent on how strongly understanding of the choice therapy is.
Okay.
So the person, you're telling the person they have a choice to make. Right? When you're dealing with the cognitive therapy now, that is learning. Right? It depends on how best you understand things and how you learn things. Yes, sir. Right? With the rational emotive behavioral therapy, the role is different, where the counselor is have to be active in the session. They take control and direct.
So they direct that session
Yeah,
basically?
yeah.
Okay.
The counselor teach the client how to correct their way of thinking.
Okay.
Right? The counselor listen to the client about how they perceive themselves and interview to help the person correct that thinking.
Alright, cool.
Right?
Anything else?
Well, Basically, that the counselor will help the client live in the present rather in the past. Right? And that's basically it.
So that's cognitive in a nutshell.
That's cognitive.
Cognitive in a nutshell. Alright, cool. So who else do we have next?
Humanistic theories.
Alright, cool. That's
Well,
it.
you see, Kimara can't wait to deliver this. Kimara, take it up, sure.
Okay, humanistic theory.
Sorry.
Humanistic theory focuses on the potential of individuals to actively choose and purposefully decide what matters related to themselves and their environment. The professionals in this field embrace humanistic counseling in a bid to help people increase self-understanding through experiencing their feelings. We have the person-centered counseling, existential counseling, and the gestalt therapy. In person-centered counseling, this was developed by Carl Rogers. It helps the person identify most with themselves. Rogers believed that humans are characteristically positive, forward-moving, constructive, realistic, and trustworthy individuals. Person-centered theorists believe that each person is capable of finding a personal meaning and purpose in life. For a healthy self to emerge, a person needs positive regard, which is love, warmth, care and respect, and acceptance. For the person-centered counseling, the role of the counselor will be to set up and promote a climate in which the client is free to be encouraged and explore all aspects of themselves. The goals of person-centered counseling center around the client as a person, not his problem. So he focuses on the person himself and not the problem that they're experiencing. Rogers emphasizes that people need to be assisted in learning how to cope with their situations, as opposed to fixing the situation itself. Some of the techniques used in person-centered counseling is empathy, unconditional, positive regard, and congruence.
What you do with the art, right, as we get all the perspectives, we put everything together. So we have the people, we have each specialist, psychological counseling specialist, right, present their parts. So some of you do the psychoanalytical, obviously cognitive, Kimara, the humanistic, and you just sit down, basically in front of the camera, and you say, well, you know what, mass, our psychoanalytic approach, counseling, strategies would be they talk just a little brief. They don't have to be no wrong essay paper kind of thing.
No, just maybe like a minute. 2 minutes.
So you talk about what it deals with, the psychoanalytic approach, it came from where it deals with. You talk about the goals and the techniques and that's it. So, a little history of etiology. Right? A little etiology, now use it. A little etiology.
The jargon.
The jargon. A little etiology. Then we speak about the goals. Then we speak about the actual technique done. Next question. Right?
We have a master. Tomorrow? I have master. Yes. But don't set it up. What? No, we can do it as part of the fun of us.
This is MES. I don't have a cheat. Do you have time? What colors?
I have two.
I have black and red.
Well, everybody needs something.
Yeah, two.
Wait for that one.
I'll see if I can get three.
No, these are tulips. Shamrock. Shamrock is a cheap one. No, they're not being small. They'll be small. Some person.
Aye.
Yeah. We'll fix that tomorrow. Alright, cool. Alright,
Let me
so.
think, you know, the presentation, let's start with the presentation with mass coverage and then after that, keep up the mass. Like this is a function or something. So everybody select, remember the end logo and take the question and talk to yourself because we care, right?
Right.
So after you go on the thing, we have mass and then people on the screen because we can bang by sheet. We have mass and then people put it on the screen and at the end of it, whatever.
So each
Yeah,
person,
they don't like
person-
taking up the mass and say because we care.
so the mass signifies, oh my god, I'm getting goosebumps. The mass signifies you know, working through.
Working through
your
Yeah.
So hide behind whatever.
Yeah, the mass.
Yeah.
Don't hide behind the mass.
So high behind the
mass. Like short period of time when short period
Yeah.
and cannot reinforce the point that the mass coming out.
So we do that in the
So
ad.
after you,
Yeah.
so each counselor is going to have that.
So you was the one who didn't like
Mass.
Well, how did mass come about?
You want
First
you
time?
want
for
the
your
sound.
mouth.
Oh,
And how does this mass?
So we get the mass and thing, right?
yeah.
So they say,
So I heard well,
so the mass signifying that you don't have to hide behind any problem. You can come here, you work it out, deal with it. And so we had mass, but say it again.
I'm the right now.
We have mass. Yeah, no, she right. So,
No, don't be writing in my books. Shucks.
What do you
I don't think so. Right.
dedicated,
You can't use
providing you with some professional, with some professional practice.
with some
Professional.
press, S-O-U-N-D.
So practice and then the punchline because we can pick up your math because we can.
No, can we say all of this together? No?
No, I think again, we look at each counselor.
No, but it will be hard for each council to say this individually. Okay. Start,
All of us?
Alison, start, say it and come now.
No, well,
In
I
terms
didn't
of
hear
time.
shot, no. I didn't hear shot.
No, I'm saying it.
Enough
But
for
then
that.
that might be repetitive. We could probably all come in.
Coming together.
What we do
math.
is when we come in together and then we say this.
And then
we say it together.
and then individually say because we care, and everybody will take up the mark with it because we care. Because we care. And it wasn't everybody saying
But you're
this.
still walking in, singing in.
Yeah.
Yeah.
Alison, that's
Yeah.
what we do.
Yeah.
And
And
then-
what I would do, what I would do, we use different.
That's not that, right?
Yeah, my
What
house.
we do, we use different locations in your home. Then we have different shots. So everybody will be sitting in the same macro. I'm gonna fix that tomorrow. Alright? So we ending off with the mass. We all come into the area and we will
I'll be using this, I'll be saying this.
using this and then we'll say
When we come here and everybody come in 1, 2, 3, 4, 5, we say in the line together, we at Mass is dedicated to providing you with sound professional practice. Also with love. You will take off because we care. Because we care.
what we could probably add.
So well, the setting, I think we could probably have a projector with the logo in the background like on the wall and we can have like a table or something like this and we walk in and sing. Marissa. Put it on the top. Marissa. Alison. Sam. Mara. We at Mass and what do you say that? We at Mass and pick up the mass because we care.
I like that.
Right?
I like that. So
Okay. Are you tired, frustrated, depressed? Do you feel like your life is out of control? Have you considered getting help? Well, it's time to be unmasked.
Hi, I'm Summer, and at Masked, under the Freudian school of thought, we dig into the unconscious mind to deal with any childhood experiences that may have been unresolved. Our goal is to help you cope with the demands of society, make an environmental adjustment, and strengthen your ego. So come in, let's have a chat. because we care.
Hello, I'm Alison, family counselor here at Psyc. I specialize in the cognitive therapy. I will help you intercept and analyze negative thoughts with the aim of restoring proper functioning. So, come to us for quality service because we care.
Hi, I'm Kamara, and here at Psyc, my role as a counselor is to deal with you, the individual. I specialize in the humanistic approach. I will use person-centered, existential, and gestalt therapy to assist in the restoration of social functioning. My goal is to focus on help the client discover their purpose in life and make the right choices. So come see me today. At Psyc, we help you embrace life because we care.
So, we're saying what really bothers me about psychological counseling in Trinidad and Tobago is mainly two issues in it. One, licensure, and two, fragmentation. I mean, someone can actually go and do a layman's or a counseling course overnight, and then you're in a room dealing with people and their life issues. I think that could be potentially damaging.
Yes, for sure, Devon. However, one thing we can guarantee you is that here at Psyc, all our counselors are professionally trained and licensed in accordance to the international standards. So, however, we will definitely be among the best.
And you know, that's very reassuring. When you come here, you get professional service.
So come in and check us. You know why?
Yes, person.
Because we care. Hi, my name is Marissa.
I am Alison.
Hi, I'm Summer.
My name is Kamara.
And I'm Devon.
We at Psyc are dedicated to providing you with sound professional service. Because we care. So please, come in today. Let us help you remove the mask that is preventing you from living a happy life. You can call our offices at 222-0001 or visit our website at www.masscounseling.org. Come in today.
Yes, and Alison is putting on makeup.
You have to look cool for the women.
Okay, but that's how it's not.
Go on.
Do this.
Oh, no,
And
your
this.
mask.
Alright, cool. No, I did that too because I fixed my hair.
Huh?
I fixed my hair because we care.
So please, come in today. Let us fireball.
Do so.
Alright, calm down.
3, 2, 1.
So please, come in today.
3, 2, 1.